if you could take over, please.
Yeah, thank you. Good afternoon, and thank you very much for having me on this platform. These are unprecedented times, and we are battling our way through uncharted territories. It's a war where the enemy is invisible, a war where there are no guns and bullets, a war which has no boundaries or territories, a war which has no rules, and a war we are supposed to be winning with one simple but potent weapon, and that is sitting at home. I'm sure not even the most creative mind or the most crazy mind would have ever imagined a situation like this. The good news is we are winning the war, and that too very soon. I'm saying this with a lot of confidence and a scientific basis. COVID is not the first infectious disease we have seen. Not long ago, we had swine flu. Influenza, dengue, and malaria are there every year. Except for smallpox and polio, we have not been able to eradicate any other infectious disease. Since we started counting the number of corona patients and corona deaths, more number of people have died because of influenza. Soon, corona will become a part of the disease burden of the country, and the panic and stigma will disappear. However, the pandemic has taught us many lessons, and like other crises, created new opportunities. Our routine way of living and working has changed. A new normal has emerged, and this is with us to stay. I'll spend the next couple of minutes on what this new normal will be in healthcare. One of the most abused phrases is health is wealth. We used it extensively without really understanding its value. Billions of dollars have evaporated into thin air over the last couple of weeks, and the value of health has never been better understood. Another phrase which we are very familiar with is prevention is the best cure. We seldom paid attention to prevention, and Corona has sent the world into a lockdown aiming to prevent the spread of infectious diseases. Emphasis on health and preventive healthcare is going to be a part of the new normal in healthcare. Corona is not going anywhere, and dealing with it will become a part of the new normal. Hand hygiene, social distancing, masks and PPE, screening, and avoiding crowds must all become a part of the routine. We have the responsibility of protecting our patients, doctors, and staff from corona, and healthcare providers would need to change behavioral patterns. While we take steps to prevent corona, equal emphasis must be laid on prevention of other diseases, particularly the non-communicable diseases, which are responsible for 70% of deaths worldwide. Newer healthcare models, which were in various stages of health evolution, will now become mainstream. We've been talking about telemedicine for years, but little was happening on the ground. Corona has changed it all. Delivering care using technology is here to stay. Home health is the next delivery model, which will grow significantly. When we combine telemedicine and home health, a whole new model of care will be the new normal where the patient is at home and healthcare is delivered right there. Imagine a situation where one has fever. He connects with the physician for a teleconsult. The physician orders for some investigations. The samples are collected at home and results are uploaded into the patient health record. The physician reviews the investigations and prescribes medications online, and these medications are delivered home. In a connected world, this is possible, and Corona has pushed this new model of care into the mainstream. Very often, teleconsults are thought to be a conversation between the patient and the physician. We've evolved far beyond that. The physician can actually hear the breath sounds, heart sounds, check the blood pressure, check the SpO2, take an ECG, do an ultrasound, and even do an echocardiogram. The new model, therefore, is beyond the traditional teleconsult. And when you add a layer of artificial intelligence onto it, the outcomes are better and variability is removed. In the new model of care, number of hospital beds become irrelevant. Telemedicine, home care, minimally invasive surgery and procedures, robotic procedures, better technology, improved pharmaceutical options, and better human skills, aided with technology and the layer of artificial intelligence, will deliver care at home or make even the most complex procedures short stay or daycare procedures. Healthcare industry needs to prepare for this new normal and change its infrastructure, processes, skill sets, and technology to suit the new model of care delivery. Many other changes are on the way. Delivering more for less. That is, delivering better care at a lesser cost to the patient is the new normal. We need to learn the art of constructing and operating hospitals at a lesser cost, while we use technology to deliver care that is faster, better, and cheaper. Payer models will change. Hospitals were dominant players so far, and they were dictating the pricing structures. This is changing rapidly. As there is consolidation of large groups of people under different payer segments, the dominance of hospitals is fast decreasing, and payers are beginning to gain the upper hand. Private healthcare grew rapidly in India over the last 4 decades, essentially due to the lack of involvement of the government. With government, with COVID, we've seen the government becoming active on the healthcare front, and they will continue to play a major role in the future, as we saw in the finance minister's announcement just. Healthcare is poised to become the 4 Ps, which is public, private, and payer participation. Numerous such changes are making their way into the health sector, and the sector needs to accept a new environment which is challenging. COVID has also brought a new jargon, for example, being vocal about local. And when someone challenged it by saying that we are isolating ourselves, a new word came up called glocal. That is, we will be so strong locally that we will automatically become global. Private healthcare in our country has been local. While delivering good care to our population, we were amongst the top 10 global healthcare destinations. We need to ensure that we build on the global phenomenon in Indian healthcare and do this. We need to take advantage of the new normal in healthcare. I'm willing to take any questions on this.